This video will cover the mechanism of action and side effects of Ozempic, also known as semaglutide. This GLP-1 receptor agonist was approved by the FDA for type 2 diabetes and obesity management and is administered as a weekly subcutaneous injection. Ozempic is a GLP-1 receptor agonist, and semaglutide is a synthetic analog of human GLP-1. It is administered as a subcutaneous injection once weekly and has a half-life of about 7 days. The approved indications include type 2 diabetes, chronic weight management, and cardiovascular risk reduction. GLP-1 is a natural incretin hormone. It has 4 key functions. It stimulates insulin secretion, suppresses glucagon release, slows gastric emptying, and activates brain satiety signals to reduce appetite. At a molecular level, the mechanism involves 4 steps. First, injection and absorption, where semaglutide is absorbed and protein-bound. Second, GLP-1 receptor binding across various organs. Third, the CAMP cascade leads to membrane depolarization. Finally, this triggers insulin secretion and glucose-dependent insulin release. Ozempic provides beneficial effects on pancreatic cells. It increases glucose-stimulated insulin secretion and promotes beta cell proliferation. It also reduces glucagon secretion and hepatic glucose output, leading to a net reduction in blood glucose levels. The side effects of Ozempic range in frequency. Very common side effects, occurring in over 10% of patients, include nausea, vomiting, diarrhea, and constipation. Rare but serious risks, less than 0.1%, include thyroid C-cell tumors and renal impairment. Gastrointestinal side effects are the most common and dose-dependent, typically resolving within weeks. Nausea occurs in 44% of patients, peaking during dose escalation. Diarrhea and constipation both occur in 24% of patients, while abdominal pain is reported in 20%. Semaglutide offers beneficial cardiovascular effects, notably a 14% reduction in MACE and reduced cardiovascular death risk, alongside lowering blood pressure and LDL cholesterol. Adverse effects include a mild increase in resting heart rate and potential hypotension when combined with antihypertensives. Ozempic carries an FDA black box warning regarding the risk of thyroid C-cell tumors observed in animal studies. It is contraindicated in patients with a history of medullary thyroid carcinoma. Pancreatic risks include uncommon acute pancreatitis and a rare but uncertain long-term risk of chronic pancreatitis. GLP-1 receptors are present in thyroid C-cells, which may stimulate calcitonin secretion. While C-cell hyperplasia and medullary thyroid carcinoma were seen in rodents at high doses, these findings are not confirmed in humans. Calcitonin levels may increase slightly in both rodents and humans. Renal effects include nephroprotective benefits, such as reducing urinary albumin excretion and slowing diabetic nephropathy progression. Adverse renal events primarily include acute kidney injury due to volume depletion from severe GI side effects, requiring caution and monitoring. Neurological and psychiatric effects include common side effects like headache at 9% and fatigue at 11%, often during dose escalation. Dizziness occurs in about 7% of patients. The FDA is reviewing a signal for depression and suicidal ideation, and research suggests neuroprotective potential. Ozempic has a low standalone risk for hypoglycemia because it is glucose-dependent. However, when combined with sulfonylurea, the risk becomes moderate, and with insulin, the risk is high. Symptoms to watch for include shakiness, sweating, and confusion. Cholelithiasis, or gallstones, has an incidence of approximately 2.2% with semaglutide compared to 1.4% with placebo. The mechanism is believed to involve rapid weight loss and reduced gallbladder motility. Monitoring with ultrasound is recommended if symptomatic abdominal pain develops. Rapid glucose lowering can paradoxically worsen diabetic retinopathy, a phenomenon seen with all intensive glucose-lowering therapies. Patients should have a baseline retinal exam before starting treatment. Management involves slower HbA1c reduction in at-risk patients. Ozempic interacts with several medications. Combining it with sulfonylureas or insulin increases the risk of hypoglycemia, necessitating dose reduction. It may delay the absorption of oral contraceptives. Warfarin's INR may change, requiring frequent monitoring. Metformin has no significant interaction. Absolute contraindications include a personal or family history of medullary thyroid carcinoma and multiple endocrine neoplasia syndrome type 2. Use with caution in patients with a history of pancreatitis, severe GI disease, or end-stage renal disease. Managing side effects involves starting low and going slow with the dose. Inject on the same day each week and eat smaller, lower-fat meals. Stay hydrated, especially during vomiting or diarrhea. Use anti-nausea strategies like ginger tea and seek care for severe abdominal pain or visual changes. Key clinical trial data highlights include the SUSTAIN-6 trial, showing a reduction in stroke and heart attacks. Step 1 demonstrated an average of 14.9% body weight reduction. The PIONEER-6 trial confirmed cardiovascular safety, and the FLOW trial showed significant nephroprotection. In summary, semaglutide is a highly effective GLP-1 agonist for type 2 diabetes, obesity, and cardiovascular risk reduction. GI side effects are common, transient, and manageable. Hypoglycemia risk is low in monotherapy. Overall, it has a strong benefit-risk profile with proper patient selection and monitoring.